More than 60% of the referral cases presented to the veterinary clinics are diagnosed and treated in the medicine unit. Advanced diagnostic techniques like ECG, echocardiography, ultrasonography, esophagoscopy, bronchoscopy, lung lavage, and transtracheal wash are routinely used. Treatment facilities for hemodialysis, blood and blood component transfusions have been established and routinely used. In spite of the best diagnostic techniques, accurate diagnosis is often elusive without a systematic physical examination. Physical examination is the most reliable, useful diagnostic tool with a veterinarian. Unlike human patients, subtle clinical signs which go unnoticed by caretakers, these can be observed with the help of physical examination. Physical examination, when it is combined with a meaningful history, it is helpful in the localization of the problem to an organ or a system. Physical examination starts with visual examination of a patient. The animal is observed from a distance with minimal disturbance to the patient from all the convenient angles. In this examination, animal is observed for general behavior, body condition, posture, gait, or any abnormal actions. Observe the gait of the animal closely as the animal moves into the examination area, or the owner may be asked to lead the animal for this examination. The gait of the animal should be observed for abnormal weight bearing, foot placement, limb protection and flexion, and direction of limb movements. Abnormal gait may reflect a musculoskeletal or neurological disease. The primary objective of observing the general behavior is to determine the severity of a disease, which can be assessed by response to external stimuli or response of animal to your presence. Mentation should be observed for any abnormality. Animal with abnormal temperament is classified into depression, apathy, hyperexcitability, or frenzy. Generally, mentation is unaffected in diseases with minimal systemic effects. Depression is often observed in systemic inflammatory diseases. Apathy is often a sign of diseases affecting brain function or diseases with severe systemic effects. Hyperexcitability and frenzy are a reflection of acute neurological disorders or severe painful conditions. Body condition is assessed to determine the severity and or chronicity of a disease. It should be assessed by observing the prominence of ribs, the shoulder region, dorsal spinous process of the thoracic and lumbar vertebrae, and the tissue around the base of the tail. Then next is the posture of the animal. In a standing animal, the posture is observed by noting the relationship of head, neck, legs and tail to the trunk. Also, contour of the spine and tone in the abdominal muscles should be observed for the evidence of interior abdominal and thoracic pain. If the animal is recumbent, attention should be paid to the position of head and limbs to the trunk. After completion of the visual examination, hands-on part of physical examination is carried out. Cattle are usually less apprehensive and familiar with human beings, so the patient is always approached from the rear side. First of all, we have to record the rectal temperature. For recording the rectal temperature, the thermometer is placed in the rectum. It must be ensured that the bulb of thermometer touches the rectal mucosae and is placed in for 2 minutes. While the thermometer is in place, we have to record the pulse rate from the coccygeal artery which can be located about 6 to 8 inches from the base of the tail. It is important to know some physiological factors that may affect the rectal temperature. That is, the animals which are excited, which are exposed to high environmental temperatures or humidity, they may show a higher rectal temperature which exceeds 103 degree Fahrenheit. In addition to this, neonates possess poor thermoregulation, so their body temperatures may be half or 1 degree Fahrenheit higher as compared to the normal critical limit. The upper and the lower values of rectal temperature should also be adjusted according to the ambient temperature. Also, there is diurnal variation which will show a half or 1 degree Fahrenheit variation in the normal temperature. So as we have already recorded the pulse rate while we were recording the temperature, in adults the pulse rate is around 60 to 84 beats per minute. In calves it is around 70 to 100 beats per minute. While standing at the back of the animal, we'll have to look at chest and abdominal movements for recording the respiration rate, which is to be done for a minimum of 30 seconds. A normal respiration rate in an adult dairy animal is around 15 to 30 breaths per minute. Again, we are already standing at the rear side of the animal. We have to examine the vaginal mucous membranes for color, any discharge or smell. From abnormal colors like pallor or icterus may be indicative of anemia or jaundice, and the discharge could be an indication of any reproductive abnormalities. Then already we are standing on the rear side of the animal. Over here we have to palpate the rear side of the udder, and for palpating the supramammary lymph nodes we have to support one quarter with our left hand and start palpating the supramammary lymph nodes with the other hand by moving from the medial to the lateral side. Abnormally enlarged lymph nodes or glands may be indicative of any lymphoma or mastitis. After completing the rear examination, move to the left side of the patient. To auscultate the heart, we draw an imaginary line halfway between the point of elbow and the point of shoulder. Heart sounds are auscultated at 3 sites, that is the 3rd, 4th and 5th intercostal space for pulmonic, aortic and mitral valve. More precisely, the pulmonic valve is located at 3rd intercostal space just ventral to this imaginary line. The aortic valve is located at the 4th intercostal space dorsal to this imaginary line, and the mitral valve can be auscultated in the 5th intercostal space ventral to this imaginary line. Furthermore, these points should be searched for the point of maximum intensity. The heart is auscultated for rate, rhythm and intensity of sounds. In some animals, always consider the position of limb while auscultation. If needed, the forefoot may be pulled forward for better interpretation. During the interpretation of heart sounds, the thickness of body wall should also be taken into consideration. Then coming to the various types of heart sounds that we can auscultate, the pounding heart sounds may suggest severe anemia or endocarditis in some cases. Then is the increased amplitude of the heart sounds. These may be observed in thin cattle or in the animals with consolidated ventral lung fields. Then, if we auscultate decreased intensity of the heart sounds, this can be due to hypothermia, shock, endotoxemia, severe dehydration, or in case of obese animals. Then, if we are auscultating excessively low amplitude of the heart sounds, which is known as muffled sounds, these are observed in cases of pericarditis, pneumomediastinum, displacement of the heart by any thoracic mass or diffused myocardial disease. Heart sounds may radiate over a wider area of chest when conducted through a fluid in the chest, that is the pleural effusions, or due to some solid masses, that is the consolidation of the lungs. It is important to consider that heart sounds may radiate to the left flank through the dry rumen contents, which is completely normal and is not abnormal. The lung field region lies over a triangle. The dorsal border of this triangle runs from caudal border of scapula to 11th intercostal space at the level of tubercocci. Cranial border extends from caudal angle of scapula to olecranon process. Basal border is in the form of a straight line from olecranon process to 11th intercostal space at the level of tubercocci. Start lung auscultation horizontally from dorsocranial area caudally in each intercostal spaces for a minimum of 1 or 2 breaths at each side. Auscultate one area, then we have to move to the next till the entire lung area has been auscultated. The free hand while the lung auscultation rests on the back of the animal. Usually, the dominant bronchial sounds mixed with vesicular sounds are audible in the entire lung field except 1/3 of the caudodorsal lung field where only the vesicular sounds are audible. After the auscultation of the lungs, we will proceed to the left abdomen. First, start with the assessment of rumen. Observe the rumen for fill at the outset and palpate for rumen consistency. Then we have to record the rumen motility for about 2 to 3 minutes by palpation. Then the examination should be continued with combined percussion and auscultation to detect any resonant pings for gaseous or gas-filled distension of the viscera in left abdomen. These pings can appear due to the ruminal gas cap, left displacement of the abomasum or pneumoperitoneum. The ruminal ping will occupy the left paralumbar fossa dorsally to the spinal column, from tubercocci cranially to the paralumbar fossa. The left displacement of the abomasum, the ping for this can be assessed at between the last 2-3 ribs, and it rarely extends beyond the 13th rib into the paralumbar fossa. Then the prescapular and the prefemoral lymph nodes are palpated for any inflammatory process of these regions. We have to palpate the skin from top line and moving down in the abdominal and chest wall area for any subcutaneous gas or edema. The location of the pings suggests distension of the viscera in the left abdomen. After the auscultation for the ruminal area, we have to check the animal for any evidence of pain, for which the wither pinch test is done, in which the withers are pinched very hard, and simultaneously we have to auscultate the larynx or trachea for any grunt. Similarly, for the evidence of pain, deep palpation of the xiphoid region is done, for which we have to again auscultate the larynx and tracheal region for the grunt. Subcutaneous abdominal vein is assessed by palpation for any thickening of its wall, distension or pulsation, maybe that could be due to the right-sided heart failure. During the head examination, first of all look at the facial symmetry by observing the position of ear pinna, bony contour and cheek area. Abnormal eye positions are sign of 3rd, 4th or 6th cranial nerve dysfunction. Then we have to look at the position of the eyeball in palpebral fissures. The eyelids and eyeballs should be observed for any swelling, lacrimation. Then observe the conjunctiva for color or any swellings. The sclera should be observed for color, circulation and moistness. Then the position of eyeballs in the eye socket should also be observed. Dryness or sunken eyeballs suggest dehydration or emaciation. Look at the external nostrils for evidence of dyspnea in the form of flaring up. Closely observe the nasal mucosa for color or any other abnormality like ulceration. Also look for any discharge from the nasal cavity. Note down the airflow from both the nostrils. Abnormal breath smell, that is acetone-like odor, should also be noted, or halitosis or putrid breath smell is indicative of suppurative gangrenous pneumonia. For mouth examination, avert the lips to examine dental pad, gums, cheeks for any visible lesions. Then open the mouth for examining the buccal cavity for retention of feed, dentition or any abnormal smell. For ear examination, we have to palpate the ear pinna at the base for any pain, swelling, etc. Then examine the ear canal for any discharge or growth. After head, anterior cervical region is examined. It starts with examination for any swelling or pain response, followed by deep palpation. The procedure involves pressing both hands caudal to vertical rami till the fingertips touch each other. Pharyngeal abscesses or enlarged retropharyngeal lymph nodes can be easily palpated. Also, observe for any cough reflex which may be associated with pharyngitis. After examination of the anterior cervical region, proceed to the neck of the patient. Observe the skin of the neck for any abnormality like swelling, laceration and bone deformity. Evaluate the hydration status by recording the skin tenting time. Move the neck sideways, upward and downward to elicit pain response if any. Larynx should be palpated for enlargement or pain. Trachea is then palpated for its contour, deformity, focal swelling and pain. Repeatedly manipulate trachea for a minute to observe for any coughing reflex. Animals with respiratory diseases often manifest coughing. Closely observe the jugular furrow for visible engorgement or pulsation. Also note the extent of jugular pulsation. Visual pulsation up to 1/3 of the neck from the thoracic inlet is physiological and is often observed in lean animals. Any soft, collapsible swelling in this region is associated with esophageal dilatation. Then palpate the jugular furrow by rolling your hand over the jugular vein for any subtle jugular vein engorgement, thrombosis or thrombophlebitis. Subtle bilateral jugular engorgement is invariably an early clinical finding of congestive heart failure and pleural effusions. Tricuspid valve can be auscultated on an imaginary line at the 3rd to 4th intercostal space midway between the point of elbow and point of shoulder. Final adjustment may be made for listening the area of maximum intensity. Then proceed to the auscultation of right lung, similarly as we have already done for the left lung. Right paralumbar fossa is observed for any visible distension. Then examine the right flank by deep palpation. Enlarged painful liver or abscess or enlarged lymph glands can be easily appreciated. Right abdomen is examined by succession to detect the fluid accumulation in intestines or abdominal cavity. These fluid accumulations can be associated with intestinal stasis or intestinal obstruction. Then perform ballotment of the abdomen. Presence of a firm mass may be suggestive of abscess, tumor, or impacted abomasum. Observe for pings associated with cecal dilatation, right displacement of the abomasum or torsion. First is cecal ping. It extends from tuber coccyx cranially through the paralumbar fossa. Next is the RDA ping. It extends from cranial right paralumbar fossa to 9th intercostal space and appears as a semicircle with a diameter of 18 inches. Diameter of ping is almost double of this diameter in case of abomasal volvulus, which extends up to 3 feet. Then is spiral colon ping. It may be observed in right dorsocranial paralumbar fossa extending to 10th intercostal space. It is round in shape with a diameter of 10 inches. It has no specific diagnostic value and is commonly seen in anorectic animals. For rectal examination, lubricate your hand with a non-irritant lubricant. Examine the perineal area for visible abnormality and assess the anal sphincter tone. Collect small amount of feces from rectal ampulla and observe for comminution, color, smell, and any abnormal constituent. Offensive smelling feces may be suggestive of abdominal sepsis like peritonitis or prolonged fecal stasis. Palpate genitalia for size, shape, and presence of abnormalities. Assess the size of urinary bladder. Explore dorsal sac of rumen for size and consistency. Attempt to determine the size of ventral ruminal sac. Then explore the left kidney and palpate it for its size, lobulation, and squeeze the kidney for any painful response. Distended ureter are palpable in animals with pyelonephritis. Move to the right half of the abdominal cavity. Note any palpable abnormality of intestines. Sausage-shaped palpable mass is suggestive of intussusception. Evidence of peritonitis may be suggested by distension of intestines with gas or fluid and restricted hand movement. Cecal distension is easily palpable cranial to right iliac bone. Apart from the above examination, collection of urine is an integral part of the examination. Attempt to collect urine either before or after rectal examination by repeated stroking of the perineum with the flat of one hand. Midstream urine should be collected for further evaluation. If lameness or musculoskeletal abnormality is suspected, additional examination of limbs, feet, or joints is indicated. To conclude, basic structure of physical examination can be taught theoretically, but performance and interpretation of observations require practice and experience.
To watch more educational videos on veterinary and animal sciences, subscribe the channel and please touch the bell icon. Guru Angad Dev Veterinary and Animal Sciences University, Ludhiana on YouTube.